Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. Also glad to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Middlesex-London Health Unit's Medical Officer of Health, Dr. Chris Mackie, and the Medical Director at LHSC, Dr. Adem Dukelow. And welcome to the media who are joining us again today, and a reminder to submit your questions using the question platform here on Microsoft Teams. Just hover over the middle of the screen, you'll see the text bubble with the question mark in it. When you submit your question, if you could please indicate your name, your media outlet, and who your question is for. And finally, a welcome to those folks tuning in today on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are tuning in this afternoon on the CTV London website. Let's get to our opening remarks, and we'll start today with Mayor Ed Holder. Mayor Holder. Mayor Holder, I think you're on mute today. It's Monday. That kind of happens, I think. Okay, we're just waiting for Mayor Holder to unmute. I think we're just about there. There we go.
Are we good then, Dan?
We are, Mr. Mayor. Go right ahead.
Well, thanks very much, and good afternoon, everyone. Obviously, given the weather, it was a busy weekend for traditional outdoor winter activities, which kept our bylaw enforcement officers extremely active. I'm quite pleased to report, though, that no fines nor tickets were issued. Instead, the focus was on educational messaging, mostly at various toboggan hills throughout London. We also proactively attended stormwater management ponds, which are totally off limits due to public safety. In fact, last weekend, the London Fire Department was called out to one of our storm ponds after a man fell through the ice. Luckily, he was rescued. But when it comes to storm ponds, please, it's important to remember that no ice is safe. Apart from that, several retailers were visited in response to complaints, but all were in compliance with provincial regulations and no charges were issued. On a separate note, I would like to extend best wishes for a safe and happy return to in-class learning for parents, student teachers, and staff across our region. I know there is some apprehension associated with a return to in-class learning, but there's also a lot of enthusiasm and excitement. In my view, Londoners should treat this occasion as significant and a shared accomplishment. As of today, we are one of only 4 regions across all of southern and eastern Ontario allowed to resume in-class learning. I would say as well, that's a huge boost to the mental health of children and their parents, and to a lesser but not insignificant extent, our local economy. This accomplishment didn't happen on its own, nor by accident. Rather, it happened because Londoners, as we've done so often over the last 12 months, pulled together, looked out for ourselves and each other. After significant spikes for much of December and parts of January, our case counts, while still high, are once again lower than any medium to large-sized municipality in all of Ontario. As we await the distribution of significantly greater doses of vaccine from our federal and provincial counterparts, let's continue what we've been doing and consistently, and that is to ensure that as many people as possible are healthy enough to be vaccinated when the time comes. Thanks, and over to you, Warden Cathy.
Great. Thanks very much, Mayor Holder. And good afternoon, everyone. And I would say it's a good Monday with the return of the kids to the classroom. I know that online learning has provided many challenges to families, and I trust this return is welcomed by families across our region. I would caution, though, that the return to the classroom does not signal a return to more normal behaviors. We are still under stay-at-home orders and lockdown measures, at least for the next week or so. So please continue to put the hard work in. And as the mayor said, we are seeing results because of those efforts. As we learn more about vaccine rollouts and as communities begin to prepare for immunizations, one cannot help but begin to think of life beyond the pandemic. It is never too early to begin having discussions with regards to recovery. I was pleased to listen to some comments that Lieutenant Governor Elizabeth Doddswell made last week, reflecting on these very conversations. And Her Honor shared that the pandemic has illustrated vividly the fact of our interconnectedness. Few of us in Canada can ever recall any circumstance in their lifetime when everyone everywhere has been affected by an event. Who knew about the fragility of our supply chains and how very dependent we are on other nations? Her words I take as a challenge. As a municipal leader, I am in the midst of convention season. I am fortunate enough to be having discussions with my peers, colleagues across municipal borders and with officials from higher levels of government. As governments prepare for recovery, we have to realize and understand that we cannot have the answer to all by ourselves. Recovery will only take place when all players understand systematic thinking is demanded from all of us. What we have learned is that public and private sectors are connected within each sector and with each other as never before contemplated. And I look forward to working with my peers and with representatives in the private sector to ensure that recovery for our region is calculated, inclusive, and progressive. In Middlesex, we are addressing how women's issues will have to be part of that recovery. Our Women's Caucus is keenly aware of how important a strong childcare and education system are to the success of women contributing to the economy. This will be an important consideration for all levels of government and the private sector. The Women's Caucus is hosting an event this Thursday evening. Women across the county are invited to register and attend to check in to see how we are all doing. There is no question the pandemic and economic fallout from the pandemic, of which we now call the She Session, is affecting women and families across Middlesex, the city, the province, and the country. The Women's Caucus of Middlesex County has taken this step to begin the conversation and advocate for women in the recovery from where we are today. Details of Thursday's event can be found on the county website, my Twitter page, as well as Kelly Elliott's social media. So even though we can begin to think about getting out of this and moving on, please remember to continue to be physically distant, to wash your hands, to get tested if you're showing signs of COVID, to stay home if you feel ill, stay home because that's what we're supposed to do, mask up, and above all, be kind. Dr. Mackie.
Thank you, Warden Burghardt-Jesson and Mayor Holder. Folks, it is incredibly exciting to see our numbers continue to trend down in this region and across Ontario. If you haven't seen them yet, the case counts today, 17 locally and no deaths. That's the second day in a row with 0 deaths, first time in a while. The case count of 17, however, comes with a major asterisk around transition to a new provincial reporting system. We are unsure of the case count today. 17 may be slightly higher or slightly lower than the actual case count. As the provincial system is fully implemented, we should know more later today or tomorrow to be able to confirm that number. All that to say, the recovery right now, the decline in cases is tenuous. We are walking along a path that is as thin as a razor, and it would be very easy to fall in either direction in a way that would substantially increase our case counts. The trend downwards is not a guarantee that we will continue to see downward movement in our numbers. We're still at a rate of daily case counts across the province that are higher than the peak of wave 1. If we make mistakes now, if we take our attention away from the public health measures and precautions that have gotten us this far, we will see case counts spike again. It's a particularly vulnerable phase in the pandemic as we see the new variants of concern starting to take a foothold in this community and across the province. Those heighten the risk that if we're not able to keep up with our public health measures, we will see case counts skyrocket as they have in other jurisdictions. Children are back in school in elementary and high schools this week. That is not a sign that we are back to normal. It's a sign that that's the best place for children to be right now. We cannot go back to normal right now. We're in this for many more weeks, hopefully not many more months, but we cannot let up now. The vaccine campaign is a major positive story. Today, we start our first round of second doses in long-term care and retirement homes. We are going back on roughly the same schedule that we did for the first round in those facilities. That means we start with the Oneida long-term care facility today, exactly 3 weeks after the first doses were given there. We did have a shipment of Pfizer vaccine arrive today at the Agriplex, very encouraging, and those vaccines are going out to long-term care and retirement home as we speak. Dan, I'll pause there, and I know Dr. Dukelow is here with some comments from LHSC perspective.
Thank you very much, Dr. Mackie, Mayor Holder, and Warden Burghardt-Jesson. Good afternoon. I appreciate the opportunity to join you today to provide a brief update on the pandemic or COVID-19 situation at London Health Sciences Centre. I'm pleased to report we have not experienced any new COVID-19 outbreaks at our hospitals, and the outbreak in the adult ED at UH remains contained at this time with 10 associated staff cases, 0 patients, and 0 deaths. I want to remind everyone that the UH emergency department is open and safe. It is important that people do not delay seeking emergency care at University Hospital when it's needed. We currently have a total of 20 inpatients that are COVID-19 positive. 8 of those are in critical care. While our overall occupancy has been stable, hospitals in other areas have continued to experience intense pressures on their resources. LHSC is currently working with partners from across the province to ensure capacity is appropriately balanced throughout the system, particularly in critical care, which is facing significant pressure in the Greater Toronto area. While we had prepared for the imminent transfer of up to 4 critical care patients from the GTA last week, we only have received 1 to date. We remain at the ready to accept other appropriate cases as directed by the Ontario Critical Care COVID Command Centre. The proactive transfer of COVID-19 patients requiring critical care between hospitals in Ontario is being implemented to ensure access to this enhanced level of care is maintained for all patients in Ontario that need it. As I mentioned last week, we had planned to increase our operating capacity to 85% at University Hospital. I'm pleased to let you know we were able to do so and are currently running at that level. At Victoria Hospital, we're running at 90% of our operating room capacity. This is part of our recovery plan, and I was pleased to hear the warden speak about recovery as we will continue our efforts to increase our surgical capacity as much as possible. Despite the ongoing challenges of the pandemic, we continue to be laser focused on providing patients with safe, high quality care by preventing and containing outbreaks, maintaining our surgical volumes as high level as possible, working with our health units on the vaccination program, and working with partners from across the province to ensure we have enough hospital capacity to support the needs of our community, our region, and beyond. Lastly, I want to acknowledge that it does feel like we are starting to see some light at the end of this very, very, very long tunnel. However, as Dr. Mackie mentioned, it's not yet time to declare victory on this latest wave. We must continue to do whatever we can to limit the spread of COVID-19. It's just as important as ever to follow the public health guidelines, stay home, limit your interactions outside your household, and practice good hand hygiene and wear masks. Thank you again for allowing me to join today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Mackie, Madam Warden Burghardt-Jesson, and Mayor Holder. We've got a lot of questions, so let's get to them right away. Dr. Mackie, the first question today is from Steve Young at CTV London and News Talk 1290 CJBK. And Steve asks, the COVID-19 outbreak at Emdc is growing. We're hearing of 14 more cases. Do you have a breakdown as to how many staff and inmates have it? And are you concerned about the increasing number of cases at the jail?
Yeah, great question, Steve. As we've discussed on this segment before, it's pretty difficult to control COVID-19 in the sort of setting that we're talking about here in a corrections facility. We do have a total of 42 cases at this point. 25 of those are staff cases. New cases continue to come in. The positive is it's a relatively young population, so the risk is generally lower. Second, it's obviously it's certainly on the inmate cases. This is a situation where they're confined, so the risk to spread beyond the facility is mitigated. It is difficult to implement additional precautions in a setting like the Emdc. And so we do expect that we will continue to see cases come from that facility, unfortunately. We did get results back from the variants of concern testing, no positives at that facility. So this is the regular strain of COVID and not the variants of concerns.
Thank you, Dr. Mackie. Question now from Merrick Sutherland at CTV London. Dr. Mackie, Education Minister Stephen Lecce announced this morning that access to robust asymptomatic testing has been offered to health units with students returning today. Will this testing be implemented, and how might that look?
Yeah, so what is available from our understanding is teams that can provide testing to classes or schools as appropriate. There is not capacity for testing for all students in the system, and so we will look for opportunities, whether there are, clusters or small outbreaks, whether broader testing might be assist in controlling what is happening in a school. Again, at this point, we've seen little transmission in schools in spite of a lot of testing of contacts of cases. So, we're watching that closely, and we'll pull that tool in if and when appropriate.
And Dr. Mackie, Merrick Sutherland has a follow-up question. Can you explain the difference between the two types of testing Minister Lecce spoke of today? What are the benefits? What are the reasons they would or will be used?
Yeah, so I didn't catch the briefing this morning from Minister Lecce, so I'm not sure which two tests were discussed. I can tell you that the rapid tests in general are not as sensitive as the PCR test, which has been the test used at the assessment center. The ID Now test is fairly sensitive and can be done as a nasal swab. The pan-bio test is not as sensitive. It's in the range of 50% as sensitive as the PCR, and it still has to be done as a nasopharyngeal swab, which is that deep swab right into the back of the throat through the nose. In terms of use, the ID Now test, the one that is more sensitive and can be done more easily, is obviously more applicable in terms of supporting what is happening in assessment centers. And we are looking with partners at whether we can bring that sort of testing into the assessment centers that are currently operating to enhance capacity there. There is spare capacity at the moment. There's not much wait at all for the assessment center testing. But if that system does experience increased demand because of, requiring of testing of students as they return to school or whatever reason, there is a protocol being developed to enhance that capacity there using the ID Now. In terms of pan-bio, this is the test where the ministry has offered the third-party provider. We don't have a lot of details about that at this point, and we are definitely looking at what the opportunities might be to apply it. But, we're still gathering information. And then at this point, it seems it would be most likely to be useful in the setting of a cluster or a small outbreak.
Thank you, Dr. Mackie. Let's move on to a question from Jennifer Beeman at the London Free Press. This is for Dr. Dukelow. Dr. Dukelow, are you expecting the Agriplex clinic will reopen next week, or will the shutdown be extended?
So I anticipate the shutdown will likely be extended, but it depends on the amount of supply of vaccine that we receive. As Dr. Mackie mentioned, we received vaccine today that's being redeployed, but we don't have a line of sight as to how much vaccine we'll receive next week, which is the key aspect as to when that might be able to open up again.
Thank you very much. Let's move to another question. This is for Dr. Mackie. Dr. Mackie, would pushing long-term care residents to the 42-day vaccine timeline because of limited vaccine availability be less than ideal?
Yes, Jen, it would be less than ideal to push long-term care and retirement home residents up to 42 days if we can avoid it, which we can. At this point, the supply looks like it will be adequate to offer second doses to that population in time. Obviously, it would be ideal for everyone to be vaccinated on this schedule in the product monograph, 21 to 28 days for the second dose for Pfizer. The prioritization is happening right now because the long-term care and retirement home residents are at greatest risk of death. So that's where we're making sure to hit that 21 to 28 day timeline.
Thank you. And Jen had a quick follow-up. Dr. Mackie, you mentioned in your opening remarks that there had been a shipment of vaccine received, and Jen is asking if you're able to say how many doses were received.
Yeah, the Ministry of Health, which is providing those doses, has asked that local providers don't speak to the numbers. So unfortunately, we aren't able to provide that. You're welcome to reach out to the ministry and then maybe able to give more information.
Thank you very much. And a final question here for you from Jen Beeman. Dr. Mackie, have the results of the variant testing at EMDC, and you mentioned we had the results, there weren't any variant cases of COVID at EMDC, but Jen is asking about testing on samples from Country Terrace, Middlesex Terrace, and the Men's Mission. Have those come back yet, and do we know what the results are?
At this point, of the variants of concern tests that we requested, none have come back positive. So, and we'll certainly alert the public if that does happen.
Thank you. On to questions now from James Sims at the London Free Press. Dr. Mackie, now that the schools have reopened, is there a point where if there is a rise in cases, there would be a decision to close the schools again? What are the metrics that would trigger going back to remote learning only?
Thanks for the question, Jane. I think it's important to recognize that there will be cases in schools over the coming week. I'd be surprised if we make it through this week without diagnosing a case in schools. That does not mean that there's transmission in schools. What happens in schools is because of the strict policies around making sure students get tested, as students aren't forced to test, they can stay home for 14 days if they prefer. But most students do get tested if they have symptoms. And so what that means is schools uncover those cases because of that policy of testing people that have symptoms. So we will, over the next few weeks, uncover, no doubt, several, maybe more, cases associated with students. That doesn't mean they're acquired in school. We'll investigate every case and anything that tests positive this week, for example, almost certainly was acquired prior to the opening of schools, so wouldn't be causally related there at all. You're also going to see situations, as we did in the fall, where COVID-19 is moving quickly through a neighborhood, and it affects many people in that neighborhood who all happen to go to the same school. And so you'll see clusters develop because of the effect of COVID as it moves through neighborhoods. And so again, we're going to be declaring outbreaks. Even when we do that, it doesn't necessarily mean that there is for sure transmission at school. It may be the exact situation where we're uncovering something that was picked up at home or elsewhere, as we saw for almost all of our school-based cases in the fall. So that's going to happen. We're obviously going to work closely with parents in schools and the school boards on all of those that come forward, and they don't necessarily mean that there's anything going on in terms of transmission at schools. Whenever there is, we will for sure notify the school community and the public and make sure that people are understanding the risk. So what might change would really be around the variants of concern. If we happen to have a situation where a variant of concern comes in and really changes the dynamic, right now variants of concerns represent something in the range of 1.5% of cases in Ontario. The first 4,000 tests that were done, there were only a handful of tests positive. It was in the range of 1.5% of what's happening in Ontario. So it's really not the pandemic that we have now, but it may be very easily the pandemic we have a month, 2 months, 3 months from now. If that occurs and we see evidence that there is significant spread in schools, it could really change the calculation around whether schools should be open or not. At this point, there's consensus in medical officers of health that as long as schools are operating as safely as they can, they should be open.
Thank you, Dr. Mackie. And Jane does have a follow-up, and it relates to some comments you made during your opening remarks. Dr. Mackie, if we are on the razor's edge and are vulnerable to increasing case counts, can you address the wisdom of reopening the schools and the possibility that they might drive the numbers up? For some, it might seem to be incongruous to the current situation.
Yeah, I appreciate the question, Jane, and I see how it could seem incongruous. The decision to open schools is not a decision that it's time to get back to normal. The decision to open schools is really about what is best for students in this current situation. Again, in the fall, we looked at the first 80 cases that were diagnosed in students, and 70 of those cases had positive family members at home prior to becoming positive. That means they were picking up COVID at home. It doesn't make sense to keep students out of school when they're picking up their cases at home. Across the province, that was a similar picture. Something like 60% or more in many places of COVID cases in students were acquired at home or outside of the school. So, if you've got a situation where the schools are masking, supervising, distancing children as much as possible, they've changed the way they do many things. It's not a zero risk situation, but there is no zero risk situation. Having students at home doesn't mean that it's zero risk. We know that students are still acquiring the illness, even with schools closed. So it's really, there are many considerations and trade-offs at play. The decision to open schools, again, it may as easily contribute to controlling, reducing the spread of COVID because of all the protection measures that are in place at school that are not in place at home.
Thank you, Dr. Mackie. Jennifer Beeman is back. She has another question. You mentioned the delivery of some vaccine this week. I'm not able to say the numbers. That's understood. But Jen is asking if you expect to be able to keep all long-term care residents to the 28-day vaccine timeline.
Yes, our goal is to vaccinate all long-term care residents within 21 days, and we hope we will almost certainly be able to do that given the vaccine supplies that are in-house and expected.
Terrific, and we do have one more question in the queue, so we'll get to that one. This is, again, for you, Dr. Mackie. It comes to us from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, given the latest local data, are you able to say whether Middlesex-London has passed the peak of the second wave, or is it still too early to say?
I think we can confidently say we're past the peak. We can also not at all say that we won't have another peak soon. Things are on the decline. The trend is stable enough that we can say that we are past a peak, but it doesn't mean we won't have another peak. And if you look at jurisdictions around the world where the second wave has come in and public health measures have been relaxed too early, you have seen, the cases don't go back to baseline, they go straight up. That's happened in UK, it's happened in Ireland, it's happened in Denmark, many places. So, yes, we're past a peak, but it does not mean that we will continue on the downslide. It was a very different situation in last spring when we were past the peak and summer work was coming. We know coronaviruses have a seasonal pattern, and so, when summer is here and we're seeing case counts decline, it's really good reason to believe that the cases will continue to decline. That's not the situation right now. We're past the peak, but it's the middle of winter. So we could easily see the increase in cases again if measures aren't continuing to be followed.
So not a simple answer to that question then, Dr. Mackie, whether or not we're past the peak. It's all, I guess there's context to consider there. So Andrew, thank you for the question, and thank you all for your questions this afternoon. That does bring us to the end of our questions for today's virtual media briefing. Thank you for joining us. A reminder that we will be back this Thursday at 2 p.m. So please do join us at that time. And between now and Thursday, have a great rest of your day and a great rest of the week. See you on Thursday afternoon. So long for now.